How does HPV vaccination affect cervical cancer screenings? Imagine a tool that can help prevent a serious disease but still requires careful use and regular checkups. That's what the human papillomavirus vaccine does for cervical health. It significantly lowers the risk of developing cervical cancer by protecting against the high-risk types of HPV that cause most cases. When people get vaccinated before they become sexually active, they are much less likely to develop precancerous changes or cervical cancer later on. Studies show vaccinated individuals have much lower rates of these issues compared to those who are unvaccinated. But even with vaccination, regular cervical cancer screenings remain as important. The vaccine doesn't cover all cancer-causing HPV types, and it takes years for the full protective effect to show at the population level. Screening helps catch any abnormal changes early, especially since some women may not have been vaccinated or may have been vaccinated after exposure to HPV. As vaccination rates increase and fewer HPV-related lesions are found, the outcomes of screenings change. Fewer abnormal results mean that the screening tests become more specific, reducing unnecessary follow-ups. Because of this, health guidelines are evolving. They now include HPV testing as part of screening, which is more sensitive than the traditional Pap smear alone. This allows for better detection of women at risk and can lead to longer intervals between screenings. Some experts suggest starting screening later or spacing it further apart for vaccinated women, but it's still essential to follow current guidelines until more data is available. In summary, HPV vaccination greatly reduces the chances of developing cervical cancer and precancerous lesions, which influences screening results. Fewer abnormal tests are expected as vaccination coverage grows, but screening remains vital. It helps identify any issues that vaccination alone might not prevent. Combining high vaccination rates with HPV-based screening strategies is a promising way to move toward eliminating cervical cancer. However, it's important to remember that vaccination does not replace screening. Each person's situation is unique, so consulting healthcare professionals for personalized advice is always the best approach. Regular checkups, vaccination, and following screening guidelines together form a strong defense against cervical cancer.